Hi, campus friends. Thank you for joining us today for Comprehensive Prevention on Campus. We've probably met most of you by now, but just in case, I'm Priscilla Clausen. My pronouns are she, her, hers. I'm a project coordinator at Valor US, and today I'll be monitoring the chat. So just let me know if you have any questions or concerns. Ashley's going to be presenting for you today. Ashley, do you want to go ahead and introduce yourself?
Sure. Hi, everyone. I'm Ashley Klein Jimenez. My pronouns are she, her, and hers, and I am the Director of Prevention for Valor.
Valor US, formerly known as CalCASA, is a national organization committed to advancing equity and ending sexual violence. We envision a world free from violence where the dignity of every person is valued and respected. Just a reminder that you can find this recording as well as our other web conferences and campus cohort meetings at the Hub. If you've registered and have not been approved, please email me. You can find us at valor.us/the Hub, and I will pop that into the chat as well. For Zoom reminders, a lot of you are probably pretty familiar already with using Zoom. Since that's kind of what we're doing all the time now. But just a quick run through, we'll have the text chat that we're going to be using for most of this meeting. So feel free to write any questions or reactions, responses in that text chat. Since you guys are all here now, if you want to just go ahead and introduce yourself in the chat, if you could say who you are, your pronouns, what campus you're from, and maybe just like what the weather's like in your area. Again, our slides and the recording are both going to be available later on the Hub. We're not going to be using any polling questions today. For folks who can't connect via audio or have internet or Wi-Fi issues, please call on the phone. Phone numbers should be available in the registration confirmation email. Ashley, do we have closed captioning today?
No, we don't.
Okay, great. Have it in my notes, but just making sure. Thank you all again for your patience with tech issues. We really appreciate you. And a reminder to take care of yourselves. We know that a lot of times the content and the topics that we cover can trigger feelings of concern or emotions, and even physical responses. So please make sure you're taking care of yourself. If you need to step away, that's completely fine. Feel free to turn down your sound or to reach out to us for support. Our discussion objectives today: guiding concepts to prevention on campus, challenges and opportunities, CDC technical assistance guidance for prevention on campus, widely used prevention approaches, and then partnerships and action planning. So I'm going to now turn it over to Ashley, who will be presenting for you today.
Thanks, Priscilla. And Priscilla, I don't mean to be a pain, but I'm wondering if you would stop sharing and I will share my screen. It's just easier for me to go through the slides. Okay, yep, thank you. Sorry, everyone, give us a second to just make this switch. Okay, awesome. Priscilla, can you all see this? Okay.
Yep, looks good.
Okay, awesome. Well, let's see here. Thank you again for joining us. I will see if more folks join as we go, but happy to have a small group today. If you all have any questions as we go, feel free to put them in the text chat, but we're a small enough group that we can also, you can just unmute yourself and we can have a conversation. That is not a problem. What was the other thing I was going to say? I was just going to remark that I know Sydney, the smoke's been really bad up here. So anyways, I hope everyone's doing okay. It's like such a loaded question to ask these days, how people are doing. But yeah, I'm really excited to spend some time with you all this morning talking a little bit about comprehensive prevention on campus. As the director of prevention at Valor, prevention is like what I think about every single day, and campus prevention is a kind of specifically interesting topic for me. I actually started this work working at a rape crisis center, but I was also brought on to our local campus to work on a prevention grant that we had received jointly. So anyways, that's kind of my experience with campus prevention. So I wanted to kind of start by sharing some of the frameworks or the guiding concepts that we at Valor have really let lead us in terms of how we think about comprehensive prevention on campus. And so the first thing that I wanted to share was a couple of years ago, it's been more than a couple of years now, probably close to 6 years ago, we did what we called a national scan. And we interviewed stakeholders from across the country who are doing campus sexual violence prevention work to just kind of understand like what was happening, to look at themes, to look at things that were working really well, to look at things that weren't working, challenges that people were having. And so out of that research, we came up with what we believe to be this like 3 pillars that need to exist for a campus to be really effective in not only addressing sexual violence, but also preventing it. And we also didn't just look at sexual violence. We looked at, Title IX language that would include dating and stalking violence on campus. And so those 3 prongs are that everything has to be trauma informed. And I know we spend a lot of time talking about trauma informed approaches, but anything that happens on campus needs to come from the understanding that survivors all have different needs, right? There's not a one size fits all for what survivors need. That survivors really do need access to confidential resources, whether that's on campus confidential resources, off campus, best case scenario, there's both. And that we have really strong policies that actually are implemented, right? They don't just exist on paper, but they do what they say. The second piece is that there's community collaboration and engagement, that there's partnerships happening between on-campus entities and off-campus entities. That really allows for a level of accountability that doesn't necessarily happen if campuses are not collaborating with one another. And then finally, and this is what we're going to focus the most on today, is that there's comprehensive prevention. And I'll go through a little bit more about what we specifically mean when we talk about comprehensive prevention. But like from a high level, it really kind of points to the idea that there's not one thing that we can implement on campus that will prevent sexual violence, right? Sexual violence is super complex. And so the solutions to it are also complex. We need multiple strategies. We need multiple approaches working at the same time. And we need these things to happen, not just between individuals, but also at the community level. We need them to happen at the institutional level. We need them to happen beyond campus, right? Campuses are not the only places where sexual assault takes place. And so it's not the only place where we need to implement sexual violence prevention strategies. And then finally, we can't just like kind of do something one time and think that we prevented sexual violence. We really need to constantly be implementing strategies and approaches. We really need to saturate a campus. So those are really the 3-pronged approaches that we believe campuses can address and prevent sexual violence the most efficiently. So if you do not have a public health background, some of the information that I'll talk about in the next couple of slides might seem like a different language, and it's really not necessary that you remember the actual terms, but more important that you just kind of grasp the purpose of them. And so when we're talking about the different types of prevention, we're thinking about things that happen before violence has ever occurred. We're thinking about things that happen immediately after violence has happened. And then we're thinking about kind of like these long-term responses. And so those have these different terms associated with them: primary, secondary, and tertiary prevention. And so a tertiary prevention or a long-term response would be something like intervention programs for someone who's actually perpetrated sexual violence. It would look like counseling. It would look like support groups. A secondary prevention strategy would be something like, how can we stop the harm that's happened from going any further? So it would be things like a coordinated response after a sexual assault. So like our SART team, that could be an example of secondary prevention. But primary prevention is really this idea that nothing has happened in the first place, right? There hasn't been any sexual violence. There hasn't been any dating violence. We have completely eradicated that. We've stopped it before it ever even had a chance to happen. And primary prevention oftentimes kind of gets left in the gutter because we're constantly being met with all of these crises and we need to respond to them, right? We need to make sure people are safe. We need to make sure people are getting the services that they need after they've experienced a sexual assault. And so primary prevention is often not the most pressing thing. What we believe, though, is that long term, it's going to get us to a place where we don't have the need for secondary prevention or tertiary prevention, right? Because these things are not happening. And so as we go through today, a lot of the approaches and strategies that I'm going to share are really primary prevention strategies. They're things that we're trying to put in place so the sexual assault doesn't happen in the first place. When we talk about comprehensive prevention, though, we're talking about all of these forms, right? Like we need all of them. There are still survivors. Even if we are being really successful in our primary prevention strategies, there will be people on campus who have already experienced sexual violence, either in childhood or in high school. And so we still need these other types of intervention services. This is a super blurry version of what is known as the social ecological model. So I apologize for that. If you Google social ecological model, you'll find lots of this graphic that you see here. And I'm sure you all are probably familiar with this, but just in case you aren't, the social ecological model is a framework that we often use when we're talking about violence prevention, because what it does is it highlights that we move through different realms in our daily lives. So there are things that impact us individually. There are things that impact us when we are in a relationship with other people, whether that's a romantic relationship or friendship. But there are things that happen in the larger community, and there's things that happen in society. And when we're talking about strategies to prevent violence, we have to implement things at every single one of these levels. And I'll give you an example. When I worked at a rape crisis center, we spent a lot of time doing individual level prevention strategies. We would go into middle schools and we would talk to middle school students about sexual harassment. We're really trying to you know, increase their knowledge and also change their attitudes and beliefs and behaviors as it related to sexual harassment. So we would spend time with them and have really great conversations and, you know, see these light bulbs go off, and it felt really good. But if we weren't also working at the relationship level, so working with the teachers, with the parents, then what happens when a student goes home and there's lots of kind of like these social norms happening in their families that just totally push aside what they just learned about sexual harassment prevention, right? What happens when they go out to the next class and people are being bullied and it's just like made into a joke, right? Like nothing is reinforcing what we had just taught them in class. What happens when they go out into the community and there's billboards that are like super, you know, sexually suggestive, but not just that, they're really like about objectifying people, right? I hope you kind of like see where I'm going, that if we're not working at each one of these levels, what we do on the individual level doesn't really matter. We really need to be reinforcing things through all levels of the social ecological model. It's all related and it's like a symbiotic relationship. And so we can't just do individual like workshops and classrooms, but we also need to be working on policy. We also need to be working on social norms campaigns. We also need to be working on things that give people access to jobs and economic opportunities. And a lot of times it's easier to just focus on individual strategies. And so we never get to some of these outer level strategies. We just think that, well, if we give people knowledge, you know, they'll change their behavior. And what we know from research is that's just not true. There's a lot of reasons why people don't change their behavior just because they have knowledge. When we talk about campus sexual assault, a lot of researchers and advocates have included another layer to the social ecological model, which is an institutional level, right? So there's the individual level on the campus, there's the relationships that we're in, there's the communities that we're a part of, and then there's the institution that we're actually making up before we get to the outer society. So another way of looking at these like different types of prevention is through something called the spectrum of prevention. And the spectrum of prevention is a framework from an organization called the Prevention Institute, which is located in Oakland, California. And Prevention Institute has said that, you know, we can kind of think about these levels of prevention as a ladder, right? You can either start from the top and work your way down, or you can start from the bottom and work your way up. The important thing is that we're trying to implement something at each one of these levels. So again, we're giving people information, we're strengthening their knowledge and their skills, but we're also promoting education in the community. So it's not just the people that we're actually working with that are getting the information, but it's also their friends and families and the people that they interact with. We're also educating providers. So we're educating the instructors, administrators on campus. We're fostering coalitions and networks. We're changing policy and organizational practices. It's something that encapsulates really everything we do on a daily basis, no matter where we live, work, or play. Sorry, my dogs want in on this fun. We're implementing some type of prevention strategy. And so again, when we talk about comprehensive prevention, we're really looking at, we need all of this. We don't just need advocacy. We don't just need outreach and awareness. We don't just need risk reduction. We don't just need primary prevention. We need it all. We need it all, because it's going to connect with people at different places in their lives. And we really need each and every one of these things. Again, kind of what you'll always hear me say is that we do really well with advocacy. We do really well with making sure people, you know, are aware of sexual violence. And we even do really well with risk reduction. What we don't do so well with is with primary prevention. And part of that, I really believe, is because it seems like a huge task, and it is, to prevent something, right? To prevent something like sexual violence. It's a long game. It's not something that is going to happen tomorrow or even next year, right? It's something that we probably won't see for years and years and years, maybe even a generation. But we really believe that it's possible, and that the more that people kind of embrace the idea that we can prevent sexual violence, the closer we are to actually doing it. Another thing that is, I think, a great resource for thinking about effective prevention programs are these 9 principles of effective prevention programs. And so this research is not specifically is not specific to sexual violence prevention. It's for any prevention program. So whether it's like drug and alcohol abuse prevention or teen pregnancy prevention, many prevention programs use these principles to build an effective program. And so knowing that things need to be comprehensive, right? We need all of these different strategies. We need to have varied teaching methods because people learn differently. We can't just talk to people or implement a strategy one time. We really need people to be constantly exposed over time to the same messaging. We want to, use evidence and theory that we know makes an impact. It often really does matter who the messenger is. So this idea that not anyone can just go and do prevention in some ways is really true, because it matters who people are receiving the information from. And that's going to vary depending on the community, the group, et cetera, that we're working with. I think a big one, there are lots of, and we'll talk about some of them in a few minutes, there are lots of these kind of like boxed prevention programs where you have the curriculum and you just take it and implement it. And those can be great, and they can also be not so great, because a lot of times they don't allow for adaptations in terms of like culture. They don't allow for adaptations that would allow what they're saying to be socio and culturally relevant. I'm going to turn off my camera for just a minute so I can let a dog out of the house. So we know that our prevention, in order for it to be the most effective, we need to evaluate it, right? We need to know what's working, what's not working, and we need to have well-trained staff. So something that I want to encourage you all to do, but we're not necessarily going to spend a ton of time on it right now, but it's to think about what are the prevention strategies that are happening on your campus, and to kind of map out that work. What are things that people are implementing, even if it's not coming from your work or the work that your office is doing? Sometimes campus, like student campus groups are doing prevention strategies. Sometimes there are things happening in other departments or programs. But I really encourage you all to kind of think in terms of your campus setting, like what is happening, and kind of map that out. We'll talk a little bit about that at the end too. So I kind of already said this, but I really think that, and I don't know, this is kind of like a triggering analogy right now because we are in a drought, but we're drought as well. when we are faced with not a lot of resources and people who are experiencing sexual violence at high rates, the last thing on our mind is primary prevention, right? We're spending our time and our resources, and we're trying to get people on board with folks needing access to support services and not necessarily thinking about something that might take 20 years to get to. But I do want to encourage you, especially as Title IX changes and, there's just so much kind of like unknown in our world right now, is to think like, what can we do to get to a place where our campuses are safe for everyone, where we don't just not have sexual violence, but we actually have like thriving campuses where students can show up as their whole selves and not have to worry about sexual violence? How do we fix that? How do we get to that place? And it's not by just kind of like doing an outreach event or a Take Back the Night once a year, right? It's not these little sprinkles. It's really, we need to saturate our campuses with prevention messaging. We need a whole system to come through and be present on campus year round, not just in April for Sexual Assault Awareness Month, not just in October for Domestic Violence Awareness Month, but year round, we need to be talking about prevention. Like your graphic, Priscilla. So let's talk a little bit about some of the challenges and opportunities in doing prevention work on campus. The first thing that we should just get out there, because it's true and it's important, and that's that, across the board, we don't have a ton of evidence about what works to prevent sexual and domestic violence. We have some evidence, and the evidence that we do have, we hold on to tightly, and we continue to, research and look at what people are doing in practice, but there really is limited evidence, right? We don't have a ton of evidence. We have ideas, we have things that seem, common sense, but in terms of an evidence base, there's not a ton. So that's the first thing, that's the challenge. Especially if you're trying to get people on board, people want to know, like, well, how do you know that this works? Show me the evidence. And if there's just not a lot, that can be really difficult. There's also, and I definitely saw this on the campus that I worked on, there is just so much going on a campus that it's hard to know all of the things that are happening. It's very fragmented. And an example of that, this was 10, 12, 13 years ago, but when I was working at Cal State Long Beach, there were two Take Back the Nights happening. There was one that a student group was doing, and then there was one that a program was doing. Like, how does that happen, right? And so what could have happened if those two events had come together? Like, it could have been a lot stronger. The messaging could have been more consistent. But no, there were two completely different events. And so just having like such a large campus community that many of you do, and different approaches to thinking about sexual assault, it's not a bad thing, but how do we kind of bring it all together, right? How do we be more effective and more impactful? Another thing, like I just mentioned, is that there really isn't just like, you can't just order prevent sexual assault on campus and get it in the mail and implement it and have everything, be great. There is no solution in a box. There's no one size fits all. What works on one campus won't necessarily work on another. We see this so much when it comes to 4-year schools versus 2-year schools. A lot of the strategies that 4-year colleges can implement, it wouldn't make sense on a 2-year college campus. Also, if you're at a commuter school, your strategies are going to look a lot different than a campus where most students live in dorms. right? So there's not one solution. There's no solution that we can just pull off the shelf and implement. It really is dependent upon many things, including our campus culture. Which brings me to this point that every campus has unique needs, and a lot of the kind of mainstream solutions in a box that you can purchase really don't look at students who are maybe have marginalized identities. Lots of campus sexual violence prevention like curricula doesn't really acknowledge LGBTQ plus students. Some of them are just like not relevant to students' cultures. So again, like that can be really challenging when you're talking about a campus that's really diverse, that has lots of different communities, lots of different cultures, lots of different identities. But that's where I think partnerships come in handy so much. Williams College in Massachusetts, their sexual assault prevention program works really closely with some of the other student programs on campus in order to be relevant to their needs. So they work really closely with the LGBTQ plus student center so they can craft programs that speak to that population. They also work really closely. They have a large population of veteran students, and so they work closely with the Veteran Affairs office on campus. So they're making sure that their prevention strategies are relevant to those students who they otherwise might not be reaching. And then finally, I said this again and again and again, but this is a complex issue. There's not one solution. We are really talking about needing to change our culture. Off campus, we're talking about needing to change our culture. On campus, we're talking about needing to change our culture. So it's all about culture change. It's about shifting norms that support sexual violence and replacing them with norms that say that sexual violence is not an option. And certainly there's been lots of conversation over the years about where does a gender equity perspective fit in to our sexual violence prevention work. And there's kind of different schools of thought around this, but it's important for us to know, like, how are we approaching that? Are we talking about sexual violence as gender-based violence? Are we, does it seem that the culture that we're seeing on campus is really one where things are not equitable for students of a certain gender? And so being clear on that can be really important. And then how are we measuring success, right? That's another like really big challenge, is learning how to evaluate our efforts, especially if they're not an individual like knowledge-based effort, but if it's more of like a social norms change. That's again not something that we have really learned how to do well, right? Some people have made great strides in measuring prevention, but it's hard to measure something that doesn't happen, right? So we look at measuring risk factors and protective factors, but that's hard. It takes a lot of time and resources. So that's all to say that despite all of those challenges, the opportunity is that we can create a prevention plan. We can plan something, we can have it be strategic, and we can have it be really intentional, right? We can't just kind of like throw things up against the wall and see what sticks, but we can think hard about our campus climate and about our campus culture, and we can decide what makes sense on this campus. Who are the partners we need on this campus? And what are the types of topics that this campus needs to really focus on? And so the image that you see on this slide I think does a really good job of that. So at Macalester, their violence prevention program is looking at these four things. They're looking at a cultural analysis, they're looking at bystander intervention, healthy relationships, and consent policies. Those are that's their plan. Those are the things that they are focused on. A lot of times what I see are campuses that are focused on like 50 different things. And because it's a complex issue, that's not necessarily a bad thing, but can we really implement those 50 things well, right? Or do we need to narrow it down to your top 5 different types of elements, 5 ways that you're going to disseminate information, and some really strong partnerships. So having a plan gets us a long ways. And I think, you know, this is something that I kind of use in my daily life. The greater the challenge, the bigger the opportunity, right? That's just like a way of thinking optimistically that, yes, this is really hard work, but think of all the opportunities that we have to really make changes on our campus, to make things more equitable, to make things safer, to make students feel like they actually belong. So I want to give an example from community colleges. So a challenge that we hear a lot, is anyone on here from a community college right now? If you would just let me know in the chat, I'd appreciate it. But one thing that we hear often from community colleges is that it's really hard to implement prevention work because the student body is always different, right? People can kind of enroll whenever on a community college. People come and go. They don't necessarily stay for a full 2 years. People are going to community college for all different reasons. It's not necessarily to get any type of degree or transfer. It could just be to really, you know, do a hobby, to gain some experience in a different field. Come inside. Sorry, dealing with a dog again. And so opportunity is, okay, well, the student body is always changing, so we cannot focus on them because they're always going to be different. But what we can focus on, there are things that do not change from semester to semester. And those are things like the systems that we have in place, the networks that we have in place, and the policies, protocols, and practices. So in this particular example, one thing that stays the same every year on this community college was they always have workshops for students who are new to the campus. And the workshops they cover all different topics. They cover things like how to fill out your financial aid forms, how to use Excel. And so what this sexual violence prevention program did is they worked with the entity on campus that was putting these workshops on and said, can we do one on sexual assault that's just always available every single year or every semester? And so that's something that stays the same. That will never change. Now that will always be part of that, no matter if the student body is changing. And so they were really able to find some examples of, you know, we can implement something that will just be now embedded in the school policy, even as our students change. Okay, so I want to move on and talk about some strategies for prevention. And this document is something that was released in the last couple of years by the Centers for Disease Control and Prevention. It's called Sexual Violence on Campus, Strategies for Prevention. And I think it's a really wonderful place to start if you maybe are interested in planning a prevention strategy, if you're thinking about the different types that you'd like to implement. It's a great kind of framework to walk you through that. And The document contains a prevention framework that has these 5 different pillars. And so it goes into what we've been talking about, this idea of comprehensive prevention. It talks about the infrastructure of a campus. It talks about who the audiences are on campus, the partnerships and sustainability, and then evaluation. And it goes into each one of these things. And so in the comprehensive prevention pillar, it gives some examples of how you make sure that you're working across the social ecological model. How are you hitting the individual, relationship, community, and society levels? It talks about those principles of prevention that we talked about, right? That it matters who the trainer is, relationships matter, sufficient dosage. It talks about partnerships that you would want to think about bringing into your prevention plan. It also talks about the need to really coordinate our efforts with people who are doing primarily response work. So a lot of times with prevention and response, they become very siloed. Like, you respond to sexual assault and I prevent it. When I really believe that we're doing both things simultaneously. So we should be working together. So here is an example of comprehensive prevention working across the social ecological model. And so in this example, at the individual level, that would look like maybe a bystander intervention program, right? We're teaching people how to intervene. We're teaching people healthy relationship skills. We're trying to establish healthy social norms about gender and sexuality. And we're doing all of this for incoming students. So as students come in, they're learning about bystander intervention and healthy relationship skills. Simultaneously, at the relationship level, coaches are doing intervention for male athletes, okay? And they're talking about healthy peer norms, and they are trying to shift those norms to ones that do not kind of uphold sexual violence. They're also, in the dorms, are doing some interventions that are reinforcing positive norms and skills related to bystander behavior and healthy sexuality. So there's a theme: bystander intervention and the healthy relationship norms, right? So now we're seeing this happen in 2 places. At the community level, they are working with campus leadership to promote safety and respect. There's a social marketing campaign that's looking at social norms, again, related to sexual violence, gender, and sexuality. And they may be doing some, what we refer to as hotspot mapping, which basically is an intervention where students actually locate places on campus where they do not feel safe. And then the folks who are implementing the project, you know, figure out like what's going on in this particular area that's making people feel unsafe, and how can we change those conditions. So in this example, they're doing some hotspot mapping to find out where those places are that people don't feel safe, and to figure out like what needs to change. And then finally, on the societal level, we are implementing and enforcing alcohol policy. We are trying to reduce excessive alcohol use, and we're strengthening support when it comes to enforcement response and reporting policies on and off campus. So the thing that you'll see is that there's consistent messaging across all of this work, right? They're just happening at different levels. They're engaging different strategies, but they're all really focused on building healthy norms, building bystander intervention skills, and looking at areas where sexual violence might be more likely to happen. So that's an example of a comprehensive prevention plan. In terms of the infrastructure that this document looks at, you know, they talk a lot about some of the things that we've already mentioned, that Staff should be well trained. It's not fair to anyone, including the people getting the intervention, if we just throw someone in there that is not trained well in sexual violence prevention. And so one of the suggestions that CDC makes is that there are dedicated prevention staff. I know some colleges are able to have this, and that's so wonderful. And a lot of other ones, the advocate is doing response work, they're taking crisis calls, they're doing accompaniments, and then when they have time left over, they're doing prevention work. And so, again, what happens to prevention? Typically, it's the last thing on their list of things of importance. And so really thinking about how do we as a campus decide that prevention is important to us and that we are going to institutionalize it. We're going to make a position that is focused on prevention. There are other prevention programs on campus, and if you'd like to share some of the prevention programs that y'all have on your campus, feel free to do that in the chat. But I know that when I worked on campus, there was a really robust team of folks who are working on alcohol and substance abuse, and so working closely with those folks, sometimes we're implementing very similar strategies to try to prevent one form of violence. And so being able to work together, incorporate that. And I think the last thing I'll say on this slide is working across all types of violence. Again, we know that all violence is connected. And so I have an example from Colorado. Colorado in their high schools, they were seeing two really big issues happening with high school students. They were seeing an increase in suicide, and they were seeing an increase in sexual violence. Well, they discovered that a suicide prevention program also really was a sexual violence prevention program too. The things that it focused on, it was healthy relationship skills, bystander intervention skills, connecting people to one another, building social cohesion. Those things work to prevent sexual violence and also to prevent suicide. And so they decided to implement that program to be their sexual violence and suicide prevention programs. So there are ways that we can look at, what are the themes happening on our campus? Are we seeing a lot of community violence and sexual violence? Okay, well, what are some strategies that could work to prevent both of those things? There are ways for us to, work smart and work across types of violence. In terms of our audience, I said this before, that the messenger matters, especially if we're tailoring our prevention efforts to specific communities. I remember being very naive and thinking that I could go and talk to fraternities about sexual violence. I know nothing about the Greek system, nothing. And so, I did my best, but I was not the right person probably to have those conversations. And so really thinking about, who's the champion of this? Who can we get to work with us to be able to be relevant to some of these different communities? Are we engaging parents as an audience? Sometimes just because we're, talking about college students, we don't think about engaging parents, but a lot of campuses have had success, speaking directly to parents and helping kind of reinforce some of the things that are happening on campus. I think something that, you're part of a grant program that really believes in this idea of community partners and partnerships on campus. And so you're already doing this, but a lot of campuses are not working with community partners. They're not creating staff positions. And so things are not really sustained, right? It's really based on the individual person. And if they leave, there's nothing there to hold up the work that they've done. So thinking about, how can we sustain all this work long after, we're gone? And then finally, the evaluation piece is thinking about, how do we know what we're doing is working? How do we know if we need to kind of change the course? There's been some really great examples of campuses, bringing in staff and graduate students to help with their evaluation programs. And Melissa says we definitely have this issue. Melissa, I think you're referring to evaluation. It's hard. It's hard to evaluate something even with all of the time and resources. It's more difficult to evaluate something that never happened. And it's really hard to evaluate things if you don't have a plan, if you're just kind of, doing things here and there. And so I think building evaluation into your plan can make things a little bit less stressful, but evaluation can be, it can be hard. And if that's something that anyone's struggling, we can certainly be support and connect you to some resources. I think that some of the lessons that we've learned about sexual violence prevention evaluation over the years is that we can think of evaluation creatively. It doesn't have to be kind of like, pre and post tests only, but we can look at things a little bit differently, and that helps kind of take some of that like burdensome feelings, I think, away from evaluation. All right, so speaking of evaluation, there has been a lot of evaluation in terms of sexual violence prevention. And so we do have some evidence. We do know enough about what works that we no longer need to say, well, we don't really know if this works. We can say, here are things that we do know works. This is such a big issue that we can't just sit and wait for the data to roll in. We need to take action. And so here's what we know, and here's what we're going to do. And a lot of what I'm going to share right now comes from another CDC document. This is from their Stop SV technical package to prevent sexual violence. CDC has a whole suite of technical packages across violence types. And so they do have a technical package specifically for intimate partner violence. They have a technical package for youth violence, for child abuse and maltreatment, for suicide. I know I'm forgetting at least one or two. But what I will say is that across the technical packages, many have the same strategies and approaches. So again, we could implement one of these strategies and we could prevent multiple things at once, which is really exciting. So we're going to focus on the Stop SV technical package right now. If you all have any questions, please feel free to let us know. So what is a technical package is, I guess, a good place to start. When I first heard about the technical packages, I'm just going to be very honest with you all. I was like, what in the world is a technical package? Like, what? I don't understand. I'm scared. I'm excited. I'm intrigued. It's honestly a set of strategies and approaches. It's a fancy way of saying, like, here's some things that work. But yes, they use this language. They're holding on tight to it. So here's our technical package. The sexual violence one has a cute little acronym. Not all of them do. But there are these 5 strategies, and then there are approaches that fall within each strategy. And so the 5 strategies are: promote social norms that protect against violence, teach skills to prevent sexual violence, provide opportunities to empower and support girls and women, create protective environments, and then support victims and survivors to lessen harms. So we'll go through each one of the strategies and talk a little bit about the approaches that fall within them. So the first one is really talking about, social norms. And that was in our example of comprehensive prevention, is promoting norms that protect against violence, norms that say that sexual violence is not what's acceptable in our community. And so some of the some of the approaches that fall under this strategy would include bystander intervention approaches and mobilizing men and boys as allies. And so there are lots of programs that do this. If y'all have heard of Green Dot, the bystander intervention program. There's bringing in the bystander, that is specific to campuses. There's lots of bystander intervention programs. If y'all are implementing any of these, please feel free to share. I'm always interested in what bystander programs are being implemented. When it comes to mobilizing men and boys as allies, there's lots of different ways this looks. There's an organization called Men Can Stop Rape that does this. Coaching Boys into Men is another program that really mobilizes boys under like the athletic community. And so these are ways that we can promote social norms. A lot of times, the bystander approaches are shifting this idea that sexual violence is something that happens between two people to really thinking of it as like, this is a community issue and we all have a role to play, right? Not just a victim, not just the person who's causing the harm. And when we think about mobilizing men and boys, we're really trying to mitigate some of the harmful effects of like rigid masculinity norms, and just looking at this as a problem that doesn't affect or impact men and boys. Social norms change is really fascinating because what it looks at is it seeks to change misconceptions or misperceptions of group norms. So an example of that is, if I think that all of my friends drink wine every night, and the truth is that they only drink wine on Monday nights, then a social norm campaign would aim to really correct that misperception that I have. So then I might think like, oh, well, no, not everyone's drinking wine every night, so I guess I shouldn't be either, right? So it's this idea that sometimes we assume that everyone is doing something, but they're really not. And so that could then change our behavior, and it would increase our likelihood of doing something healthier. And so on the screen, you will see an example of a social norms campaign from, I guess, it looks like they worked with a local rape crisis center. So 98% of U of A students stop the first time their partner says no. So that's really trying to, sounds like, change this misperception that most people don't stop if their partner says no, right? They don't listen. And so the goal of this is to say, no, actually, most people are doing that, right? This is a social norm. This is something that we want people to be doing, and people are doing it. And so you should be doing it as well. I'm gonna go back to that really fast. Social norms change campaigns, a lot of times, they really work at the community level because you don't ever have to talk to someone for them to be impacted by this. A lot of times they are either like media campaigns, so they might be a poster campaign, they might be on social media. It doesn't take someone having a one-on-one conversation with someone to actually receive the intervention. And so it's a really good thing to implement to get to a lot of students without having to talk to them individually. We talked about this already, but I think you all know what bystander intervention training is. It's really trying to get people to be able to identify what might not be safe, what might not be appropriate, and then give them some options to intervene and take action. Some people, there's kind of this debate in the prevention world about whether or not bystander intervention is primary prevention. And, you know, the debate is that, well, if you have to intervene in something, that means something's happening, right? So it's not really preventing something from happening in the first place. You're just kind of like stopping it from being able to be completed. So I don't know, I always think that's an interesting point. Here's some more examples of engaging men, some other programs and organizations. I think the ones that I talked about, Men Can Stop Rape is on here, Call to Men. There's also, you know, been a lot of work done by people like Jackson Katz and Byron Hurt to talk about masculinity and men's role in preventing violence against women and also other men. We're going to move on to the T in Stop SV, and that is teaching skills to prevent violence. And so that would be things like increasing social emotional learning, teaching about healthy relationships. Like sometimes we don't know what that is, right? Like we've never learned that. And promoting healthy sexuality and empowerment-based training. So some of these things happen far outside of any type of sexual violence prevention program, right? Like, and that's great. These things should be happening everywhere. An example of this could be talking about like media literacy. So thinking about, you know, what does media tell us about norms, about relationships, about sexual violence. Could also include thinking about consent education. So I don't know if any of you have read the book Sexual Citizens, but it looks at campus sexual assault and really talks about how we do not learn how to be sexual citizens. We do not learn how to like step into what we like or what we don't like. Like we just don't do a good job in our society talking about sex in general. And so when we're trying to, you know, expect college students to like navigate conversations about consent, it's pretty late in the game, right? If we haven't had this information a lot earlier. And so over the last, you know, 7 or 8 years, there's been so much conversation about consent education and affirmative consent policies. And I think those things are all really important. But if we don't have a good foundation of sex education and healthy sexuality, some of these things, I don't know how well they necessarily will work, right? If people don't feel confident in being able to say yes or no to sex, what does consent education really do for us? So just some things to think about. And so sexual health promotion to me is that much more important, that really teaching people about healthy sexuality is sexual violence prevention. Teaching people about sexual health and about you know, how to navigate these conversations is sexual violence prevention. And then when we talk about risk reduction, we are talking about, you know, these kind of things that just help to lessen our risk of sexual violence. But, you know, I think we can all agree that these can be a pretty slippery slope of victim blaming. There's really that potential to shift the burden back to victims and not to the people who are actually making the choices. At the same time, there is some research that suggests that empowerment-based like self-defense training does have really promising effects of preventing sexual assault. So like everything, not everything is all good or all bad. I think there in a comprehensive prevention strategy, there is a place for these things, right? They should not be the only thing. And we need to be having all of these other conversations, but they are not necessarily bad. So the O is looking at providing opportunities to empower and support girls and women. And some of this, I've thought over the years, like what place does this have on a campus? And honestly, like, isn't that one of the goals of a campus is to provide opportunities to empower and support women, right? When we talk about strengthening economic support, hopefully getting a college degree will lead to better economic outcomes for women. It will also lead to women being able to excel in leadership roles, but are these opportunities being presented? Are they being offered? And so I do think there is a place for them on campus. When we think about gender equity approaches, right? This is such a wordy slide, I apologize for that. But if we're talking about, is there equitable access to all of the things that we need in our lives, resources, opportunities, rights? Do those things exist on campus for women as much as they do men? I think that's the question to ask. When we get to the P in STOP, it's referring to creating protective environments. And so this could specifically look at like the physical environment of a campus. So, how safe are things on campus? Are there lots of like kind of desolate areas, or are those areas being monitored in some way? But it could also be looking at the policies that kind of govern our environment. Do we have consistently applied policies? Do people know what those policies are? Do we actually follow through on those policies? And then finally, an example would be, I shared a few minutes ago about hotspot mapping. But what are the conditions that can create environments that aren't safe? Is there a lot of alcohol use going on, in the dorms or maybe off campus? How can we impact those kinds of things? There's different ways that we can do those. And so this is an example of connecting alcohol education and policy for sexual violence prevention. Again, it could be a slippery slope because we don't want to imply that alcohol is the reason why sexual violence happens. We know though that it is a risk factor, that when there is more alcohol use, there is a higher risk for both perpetrating sexual violence and experiencing it, and that it can really create an environment where sexual violence perpetration is more likely to happen. And so I think the big thing with alcohol, connecting alcohol education to sexual violence prevention, is that we get comfortable talking about it. So I think what's happened is because there's this kind of slippery slope that exists, we just decide that we're not going to talk about it because we don't want to like say anything wrong. And that's really not the way forward, right? Like we know that it's messy, but we do need to talk about it because it is a significant thing, especially on college campuses. There's a bunch of, and I know Priscilla, you've been trying to keep up with posting all of these, but there's a bunch of research that's been done looking at alcohol policies and violence prevention. And so if this is something that you're interested in, we're happy to share more. There's also, we have an e-learning unit about the role of alcohol policies and prevention. And then the National Sexual Violence Resource Center released a report on some key findings when it comes to alcohol policy. Finally, the last SV is really looking at supporting victims, which is something that I think campuses have spent a lot of time addressing. And so having victim-centered services, having support, counseling, support groups. Those are all really important things to help lessen the harm that's been caused by sexual violence. When we're talking about younger folks, being able to identify and offer interventions to children who are maybe exhibiting some really harmful behaviors at a young age, that could also be a strategy to prevent violence from happening later on in life. And so an example under that strategy could be looking at restorative justice, right? So how do we change community norms through a restorative justice process? I know campuses have become really interested in what that could look like in terms of sexual misconduct on college campuses. And so if you are interested in that, there's a couple of resources that we would recommend, including the Campus PRISM project. It's definitely a really important conversation. And again, kind of like with the alcohol policy, it's messy. There's not a real good solution, but to find a way forward, we got to have these conversations. All right, so as we kind of come to a stopping point today, some things that you might want to think about if you're thinking like, wow, we have a pretty great prevention program, but we could scale it up. Or maybe you're thinking like, we don't really have a plan. These are some things that could maybe guide some visioning, and that is, how do you want your campus to be? Like, what should it look like? Who do you need? Who are the people? Who are the partners? Who are the things on campus that need to change? Are there physical things that need to change? Is it norms? What do you think a comprehensive prevention plan would look like on your campus? What are things that you're already doing? Stop, please. What are things that you're already doing really well? What are things that you maybe have some gaps in? Some campuses are doing amazing when it comes to bystander intervention, but that's really the only strategy that they're implementing. And so, would it make sense on your campus to also implement a social norms campaign? And then what are things that you've learned to date? What are things that you have already implemented that have really resonated with the campus? And yeah, Melissa, agree. PRISM is so interesting. The folks working on that project are just fabulous. And I think there will be more to come in terms of restorative justice. And then I think that, thinking about what's the mission for implementing prevention on your campus, what are the programs and activities that are already happening? What are the goals of those? Are you just doing it because you've always done it or it's easy? Or is there like something tied to it? And then what is your scope of influence like? Can you influence other campuses? Can you influence other departments on campus? Where are those kind of natural locations for partnerships? All right, so I just gave you so much information. I hope it was useful. I know Priscilla has shared a lot of resources in the chat, and those will all be available to you as well. But I'm wondering if there are any questions, or I'd love to, also open it up for to hear what you all are doing on campus in terms of prevention. We have about 10 minutes left. So feel free to use the chat or take yourself off mute if that interests you. I'm going to stop sharing my screen right now. I'll put my video back on. So yeah, anything, anyone? wants to share? I can share that our project Prevent Connect will be doing 2 campus-specific prevention web conferences. One is next month, and that is actually with the authors of Sexual Citizens, the book I mentioned. They'll be talking about their research and just kind of their approach to thinking about prevention on campus. So I'm trying to, sorry, give me one second. I'm trying to open my calendar so I can tell you the date of that, because we do have that one scheduled. We have not announced it yet, but I believe it's at the end of September. It is on Wednesday, September 29th. So yeah, the authors are amazing, and they'll be talking a little bit about their research. And then we also are going to be hosting a web conference with someone from the CARE office at UC Berkeley and someone from the Missouri Coalition Against Sexual and Domestic Violence. They are working with community college healthcare workers to implement sexual violence prevention on campus and in the community. So I think both of those web conferences will be really great if you're interested in hearing from folks directly on the ground implementing violence prevention. Well, we do not need to just keep you here if there's no questions or comments. So we can give you 6 minutes back of your day. But you know, if there is anything that comes up or you want to discuss anything, maybe privately, feel free to reach out to us. We'll make this information, including the slides and the recording, available on the hub, so you can refer to it. And yeah, if there's anything that you have questions about later down the road, let us know. But just appreciate you all for joining us today. Thanks, Alexis. I'm glad there was some good information in there. Yeah. All right, everyone. Well, we'll go ahead and end this. Thanks, Sydney. That's great. Great to hear. But we hope you all have a good rest of your week, and we will be in touch with you all soon. Thanks again. We'll go ahead and end this for today.